The idea for this Cancer Prevention Europe first of all came from the observation of growing numbers of cancer patients and those projections over the next 20 years or so, which are quite striking because of the ageing of the populations in Europe as well as other parts of the world. So we're faced with this growing cancer burden, and at the same time we're faced with the spiralling costs of cancer treatment and care. So it seemed very clear that to really address that challenge, we needed not only to focus on improving the treatment, which is essential, but also trying to address the prevention of the disease and its early detection, and having a more integrated approach across those different areas. This then was part of the EurocanPlatform because I was impressed by the progress that had been made in bringing these major cancer institutes together to form what's is now called the Cancer Core Europe, focusing on improving the treatment for cancer. And so I wanted to bring in a sort of twin track approach, if you like, and say, well, let's try a similar type of approach in terms of cancer prevention, bringing together some leading experts and have that as one way of integrating the whole in the future. I think we have to accept that we're further behind in terms of the integration of cancer prevention activities compared to the Cancer Core Europe. So the first thing will really be to define the scope of what is cancer prevention. It means different things to different people, and we're defining it quite broadly as describing the burden of cancer, then understanding the causes as a foundation to cancer prevention, and then actually evaluating preventive interventions and showing whether they work or not. So with that scope, we then have to identify who are the key leaders, who are the people that will drive that agenda forward, because it's not only comprehensive cancer centres, although they're an important part of the picture, but other institutes, for example, public health, epidemiology, behavioural science, many different players to bring together. And then having identified that constituency, really decide what sort of structure do we need in place to develop this idea further. I think, first of all, we should bring together into one place what we've learned about how to prevent the disease, what are the things that do work, what are the things that help implement those preventive strategies, and indeed what hinders it. So what are the examples of best practice, and make sure we share that as widely as possible, not only amongst the scientific community, but again amongst the policymakers. And the second thing would be to really identify a research agenda which is required to underpin cancer prevention in the future, and to try to prioritise some of that research, but also coordinate it. And I think the third thing, which is crucially important, is what added value can come from such a coordination. And in my view, there are many activities already in the area of cancer prevention ongoing, but they're not really linked together as effectively as they could be. I'm thinking of examples like investment in cancer registration, in cancer screening, in some of the big prospective cohort studies that are looking at the causes of cancer, and some of the biobanks, for example, associated with those. Can we bring all of this together in a more integrated fashion? I think one of the challenges with cancer prevention is, first of all, it is a broad area. It's not so easily defined, and we do need to bring together many different disciplines, all the way from the molecular sciences through to the social sciences. And of course, cancer prevention also requires a consideration of not only the cellular level, but the sort of socio-political level, in order to address things like the growing obesity epidemic, or the lack of exercise that we have in our cities because of the structure of those cities. So that's one of the challenges, is really to encompass the full range of what is needed to promote cancer prevention, but not to make it so diffuse that we don't actually achieve anything. What we have to recognise is that we can't treat our way out of the cancer problem. And so if we're going to succeed in combating this challenge of growing cancer numbers over the next 2 decades, we have to have an integrated approach to cancer control, which encompasses prevention, early detection and treatment. And in that way, we can really protect not only the patients of today, but the population of tomorrow.